Previously, I reported that the numbers did not add up whenever you looked at the numbers that China was reporting on the coronavirus, now called COVID 2019. Now, here is an article from Johns Hopkins University, and they have been modeling the spreading risk of the, I'm going to call it coronavirus because that's what we've all become used to. And they are reporting down here that according to their numbers, they actually saw that the discrepancies in the number confirmed that there was actually an infection all the way back in November in Wuhan. And Mr. Lee, Dr. Lee, the whistleblower, he noticed it in early December. So we don't know if we had very mild cases and they were becoming more severe whenever he noticed them. But they have done modeling based on the early numbers, and this was their risk of import into the United States. This was all the way back in January. They were predicting that there would have been numbers of people that were infectious but yet were traveling and were infecting other people. Now, this is the map of the highest risk U.S. cities based on the likelihood of arriving travelers. Again, this was a report all the way back from January. And this is again based on their data on airports. And at that time, they were still believing that there was only a 5-day infectious period. We now know that these numbers were suppressed, and we know that they have actually been shown to be larger than were previously reported. So Johns Hopkins has done the best they could with the data that was available to them at that time. So based on this, I'm not thinking that the United States or the UK or Australia or even Japan, that we have dodged a bullet at this time. I'm thinking that what we're seeing is just the tip of the iceberg, and that all right, here's the country importation risk. And you can see that we've got, due to the airports, we've got some serious outbreak areas due to the airports. And that so I believe that we currently have cases incubating in the United States, and I would truly doubt that our government is as prepared to handle these outbreaks as they are currently reporting. I just can't, I don't think that they have, they may think they're ready, but based on the continuing improvement in information that is becoming available, and based on modeling from Johns Hopkins and the Imperial College in London, who all did report that numbers coming out of China were initially too low, that they did not fit their statistical models. I am inclined to believe that we will see a large uptick in additional cases of the coronavirus in the developing world, in our more first world countries, the United States, Canada, Australia, the UK, and there will be an additional strain on our healthcare systems as they try to cope with these additional outbreaks and find that their preparations were not sufficient. Now, we do have the, here's the lifetime modeling. Let me just go down here again. This is the most recent. We're showing, now again, these are the confirmed cases. We're showing 43,141 confirmed cases. And again, these, I would say, are probably due to just the ones, again, that are confirmed, because not everyone is going in and getting a test. Again, we are looking at the new version of the test, so we're not even including the numbers that were not included because they did not have confirmation. They are possibly self-quarantined, expressing only mild symptoms. Here we're looking at total deaths. Definitely this is outdated since we have now gone over 1,500. All right, so this was definitely outdated data. Alrighty. And something else that bothers me is if you look at the money trails. All right, so that was the update on January the 26th. Again, so outdated for what we have going on. But as far as transparency, I am a little more inclined to believe what's going on, because if you can give me numbers and I can see a model, I'm going to, again, this was the update, the January 31st modeling the spreading risk of 2019 in COVID virus. And this is by Lauren Gardner. Now, again, if you follow the number trails, we've got the modeling data here that was being done before the new updated virus tests were being incorporated. And even at this time in late January, they were warning that there was going to be very large spread, very, you can see the estimated versus the reported cases. So here's their reported cases, and here is their modeled cases in mainland China. And as a scientist, forgive me, I have my statistical bias. I like my numbers, and I like my numbers to add up. And whenever I see statistical outliers or numbers that just don't add up. I have to question the data. And so I have been questioning the data that we have received out of China from the very beginning. And apparently, John Hopkins and some other well-renowned universities have also been questioning the data. Now, this then does beg the question, the World Health Organization, were they accepting money from China? Was the money, let's say they actually do actually accept money from China. Now, were they allowing the funds that they receive to support the WHO to influence their decisions, and their access to the country was obviously even limited by China? So we want to know, well, how much influence and how much did this put the rest of the world at risk because of the undue influence that the receipt of funds actually had upon their decisions? Again, we look to Pakistan, and we know that they are in receipt of significant, as in billions of dollars worth of funds from China. And at one time, they did actually close their borders. But almost immediately, they turned around and opened their borders. And they gave a politically correct reason for it. But we know that this is essentially a third world nation as far as their health care is concerned. And what we know is that they were putting their people at risk by doing this. However, considering that China has provided billions of dollars to support their country, especially during this time of severe economic downturn and food shortages, we must look at the money trail, if you will, and how the money flowing out of China is being used to influence decisions that impact not only our own countries, but the entire world. Also, looking at this report, again, they're believing that the outbreak, if you look at this, believe the outbreak began in November. Let me turn that a little bit so you can see. Believe that the outbreak began in November, and that there were already hundreds of human cases in Wuhan in early December. Now, and it says the estimated confirmed cases are represented in Figure 1. So what we have here, this is Figure 1, the estimated versus reported cases. All right, globally. So based on the numbers, again, I am inclined to believe that the reason for the massive immediate building of hospitals in Wuhan was to take care of what was known at that time to be an outbreak of just amazing proportions. and they knew what was happening. And to save face, they actually closed down their borders because they did not want the world to know that they had botched this up so royally, that they had possibly known that there was an outbreak all the way back in November, that they did not protect their people, and that they allowed this to continue. And now they're trying to clean up their mess, to be quite blunt. So again, in conclusion, I would definitely say that we are going to see many more additional cases as we find out that more people have been infected. And we also have data showing that people can be reinfected. And we need to prepare, and we need to realize that not all the information we're receiving in the media is transparent. We are quite frequently being fed the sanitized version or the media-friendly version, and we need to actually dig down, do a little research, and look at the actual numbers and prepare accordingly. In my case, I live in a high-rise, and for me it means making sure I can shelter in place with food and water for a full month for whenever the infections rise, and I want to avoid contamination or infection. Means making sure I have my prescriptions refilled, because again, we are looking at supply chain disruption. We do receive so many, over 80% of our active pharmaceutical chemicals we do receive from China. They are manufactured in China. 97% of antibiotics are manufactured in China. China is being smacked down royally. They are trying to get back up to speed as far as production goes, but with the devastation that the coronavirus is wrecking on their economy, I cannot help but believe that the final result will be a recession for China in 2020. And I also believe that due to, if you will, a domino effect, that the supply chain disruptions, the supply chain chaos will continue to spread worldwide and will impact every country, causing a domino recession chain effect, and that this will be the black swan that triggers a worldwide recession in 2020. This is my belief, and for this reason, I am preparing. I'm preparing for a recession by paying off debt and stockpiling cash. Also, I'm stockpiling food. But that is me. I truly believe this, that the supply chain disruption is going to cause massive chaos, and that we will realize just how dependent we are on production of items in China. And this, I hope, will be a wake-up call for all of our more developed nations that we do need to actually produce in our own countries, to not just pawn off everything to third world countries or developing countries in order to make it cheaper and faster, because that puts us in a dependent situation, which when something like this happens can actually cause deaths. It can have not just an impact on our lifestyles, but on our actual lives and our health care and our medical systems. So please consider and think about this conversation and the data that is coming out of the reputable universities. Please reconsider what you are hearing in the media and do an additional amount of thinking, please, for yourself about what the ramifications would be for your family if we did see increasing contamination and increasing disruption of the supply lines in the upcoming months. I've actually read one estimate that said we should see the majority of the supply chain disruption impact in April, because right now we are operating off of reserves. With that in mind, you do have, looking at this, I would say March is your time to start stocking up. And again, just think of it as insurance. Yes, you're spending a little bit up front, but if we, as the developed world, dodge the bullet, well, then you have this funds. They are in your house. You have food, you have shelter, and you could actually back off and not buy as much food for the next few months. So this is not wasted money. It's like wearing a seatbelt. You prepare, and if the worst doesn't happen, well, then that's good. No harm, no foul. But if the worst does happen and you're in a car wreck, then you have prepared and you have saved your life and the life of your family, and even possibly the life of your extended family and friends. So please, an ounce of precaution, and don't just think that we have totally dodged a bullet here, because it's not just the infection rate, it's also the chaos, the economic chaos that will be a result of the virus in China, the impact to our supply chains. So it's not just one item, it is multiple means of impact for ourselves and our families and our country. Take care. This is Julie Hankinson. I am uploading this post this is my Monday here in Japan, and I wish you all the best.